Hi, my name is Elizabeth and I'm a second year nursing student at Deakin University, Burwood campus. This presentation highlights the nurse's responsibility in the intraoperative phase in relation to patient positioning. Patient positioning can be challenging as there is a need to balance the needs of the surgical team, the anaesthesia team, and the patient's well-being. For example, there is the absence of normal physiological defence mechanisms when an anaesthetic has been used. And so the anaesthesia team must ensure the patient is not in a position where they may be pulling in the legs due to increased venous return or at risk of a respiratory compromise. Whereas the surgical team, they wish for the patient to be in the most appropriate position for them to have the greatest access to the surgical site. If the surgery site is on the back of the patient, they may be put in prone position. The prone position provides optimal exposure for a variety of procedures performed on the spine, certain orthopedic procedures, and some rectal procedures. However, there are a number of risks associated with the prone position, in which it is in the nurse's role to help prevent. The risks include pressure area risks on the ear, cheek, patella, genitalia, breast, and toes. There is also a risk of respiratory compromise due to the compression of the chest wall during surgery, as it is reducing oxygenation and oxygen delivery to the vital organs. There are a series of interventions the nurse can use to minimise these risks. Nurses can provide optimum respiratory function by raising the patient's chest and abdomen with supporting pattern. This means the surgeons are still happy with the positioning and the patient is also receiving an optimum capacity of oxygen. Pressure injuries are also a risk to patients undergoing surgery, as they are in the one position the entire time. It is the nurse's role to monitor pressure areas throughout the surgery and utilise tools that decrease pressure on bony prominences. Some strategies used are placing gel pads under knees and feet, and chest rolls that can also be placed under the axillae and along the side of the chest to raise weight from abdomen and the thorax. If the skin is dry and cracks are visible, then a lotion can be applied to moisturise it. Vice versa, if the skin shows too much moisture, then it may easily become non-intact and so it must be cleaned and dried. Ultimately, with every position the patient can be put in for surgery, there are risks associated. The anaesthesia and surgical team have reason for choosing that particular position, and it is in the nurse's role to minimise those risks as well as possible, using a number of interventions. This way, the quality and safety of the procedure, as well as the patient's well-being, is being upheld.